There are a lot of challenges which are quite different from country to country and more from continent to continent. I think that in Europe, the biggest challenge is the fact that if we look at the outcome is quite different in Western Europe as compared to Eastern Europe, and that the results in Eastern Europe sometimes are very similar to what we see in the developing world. This is due to the fact that there is not enough prevention there, and also to the fact that they have very little access to treatment, mainly to the new treatment. So this is really the biggest challenge in Europe. If we look worldwide, we know that there is a cancer epidemic coming up, mainly in the developing world, which means that the overall data are getting worse because in the developing world, the percentage of cured patients is much lower than in Europe or in North America. So having more cases in the developing world means that worldwide the death rate because of cancer is increasing. So someone put it like that although we are seemingly winning the war against cancer from a pure scientific point of view, from a social economic point of view, from a global point of view, if nothing is changing, we are going to lose this war. What can be done? I am convinced, and we are trying to do that with the so-called World Oncology Forum. We need a global fund for cancer, like it has been established for AIDS, because there is no coordination. Today, the WHO is doing very little in the field of cancer. So we need a new organization, a new framework, which would coordinate the fight against cancer worldwide. There are propositions, even the World Bank has established some priorities. We will meet in Lugano in October to try to come up with some billions in order to tackle this huge challenge.